Hello, I'm Jack Tracy, and I'm with the Jordan Smelski Foundation. And I'm here this morning with Dr. Tim Gompf, who is a pediatric hospitalist at Lakeland Regional Health in Lakeland, Florida. And Dr. Gompf, we very much appreciate you taking a moment to answer a question for us this morning. And so this one is for physicians. And so if I see a patient in the emergency room or even at primary care, and that patient is presenting with signs and symptoms of meningitis, bacterial or viral, how do I ensure that my diagnostic workup includes PAM, primary amoebic meningoencephalitis?
Well, really, the most important thing is you have to think of it first. Mm-hmm. And unfortunately, we see a whole lot of cases of viral meningitis and a few cases of bacterial meningitis, and rarely we see the primary amoebic encephalitis. So doctors just don't think of asking the question, which is, was there freshwater exposure?
Mm-hmm. So that's the key question then.
That is really the key. If you don't think about it, then you're probably not going to test for it.
Mm-hmm. So has Lakeland Regional Health done anything to actually ensure that this is considered when the doctor is doing the diagnostic workup?
I think hospitals need to take steps to help doctors sometimes, and we can do that now with electronic health records. So at our hospital, when the doctor orders spinal fluid and orders the cell count, there is a checkbox that you have to answer yes or no, was there freshwater exposure, or you cannot order the test.
Wow, that sounds like a tremendous help to the physician and to the patient as well, of course. Dr. Gompf, we understand that you have a personal history with this devastating disease.
In 2009, I lost my own son to primary amoebic encephalitis. I was one of the physicians who believed it could never happen to my child. So now, whenever I see any child with meningitis, I have to speak to parents about primary amoebic encephalitis and about awareness and about the risk of exposure in all these beautiful freshwater lakes that we have in our community.
Well, we're so sorry for your loss. And, thank you very much for being with us today.
Thank you.